Your heart doesn't stop working when you fall asleep. In fact, while you're resting, your heart, brain, and blood vessels are quietly responding to how you position your body for the next 6 to 8 hours. A cardiac surgeon recently shared a warning that surprised many patients. The way you sleep at night can influence your stroke risk more than you might think, especially as you get older. Most people choose a sleeping position out of habit, comfort, or relief from pain. But during sleep, blood pressure, breathing patterns, and blood flow to the brain change naturally. If your position interferes with circulation or oxygen delivery, it can quietly strain your cardiovascular system overnight without obvious symptoms. One position doctors are increasingly cautious about is sleeping flat on your back for long hours, especially if you snore, have sleep apnea, high blood pressure, or heart disease. When you lie on your back, gravity can cause the tongue and soft tissues of the throat to fall backward, partially blocking the airway. This leads to repeated drops in oxygen levels throughout the night. Each drop triggers a stress response in your body, spiking blood pressure and forcing your heart to work harder. Over time, these repeated stress surges can damage blood vessels and increase the risk of stroke. Back sleeping can also worsen nighttime blood pressure spikes. Many people don't realize that blood pressure isn't always lowest at night. In some individuals, especially seniors, it rises during sleep. Lying flat may reduce proper venous return from the brain and neck, increasing pressure in the arteries supplying the brain. For someone with narrowed vessels, plaque buildup, or weak circulation, this added strain can be dangerous. Another overlooked risk comes from sleeping with the neck sharply twisted or bent. When the neck is compressed or rotated for hours, it may partially restrict blood flow through the carotid arteries, the main highways supplying blood to the brain. In people with existing arterial narrowing, even mild compression over many hours may reduce oxygen delivery enough to raise stroke risk. So what position do many heart and brain specialists recommend instead? Side sleeping, particularly on the left side, is often considered safer for circulation and breathing. Side sleeping helps keep the airway open, improves oxygen flow, and reduces pressure fluctuations during the night. It can also support better lymphatic drainage and reduce nighttime acid reflux, which indirectly benefits heart health. Using the right pillow height is just as important as position. A pillow that keeps your neck aligned with your spine helps maintain steady blood flow to the brain. Too high or too flat can strain arteries and nerves over long periods. If you have high blood pressure, diabetes, atrial fibrillation, or a history of mini-strokes, your sleeping position becomes even more important. Small nightly improvements, repeated every day, can have a powerful long-term impact on stroke prevention. This doesn't mean one night of back sleeping will cause a stroke, but over years, poor sleep positioning combined with other risk factors can quietly raise the danger. Listening to your body, improving sleep posture, and managing underlying conditions can protect your brain while you rest. Your sleep should heal you, not harm you. Tonight, the way you turn in bed might be one of the simplest steps you can take toward a healthier heart and a safer brain.